by the combination. He works in, it's Thomas, in the backside there, and he works for Morphosys, and Morphosys has been purchased by Novartis. And I assume it's obvious, but they think that his product at Novartis, Yakavi, together, but they have a good result. I don't know how much you can talk, Thomas, about your situation, but let me know, how do you see it? I mean, you're very much involved in MPN. Maybe you give us your point of view.
Yeah, happy to. And bear with me, I'm not a physician, so I think that was all very, very well said already in the front. But maybe just to add a little bit of commentary from us. And I think first of all, I think it's great to see that there is so much progress in research and developing of additional drugs, combinations in the field of MPNs, because I think we need more. I think we all agree on that. And it's great to see that, especially for myelofibrosis, that there are now combinations coming. Because there are so many, symptoms that we cannot control as best as we can with the monotherapy. So I think that's great. So from our perspective, we see that as a new frontier. And with the data that we were able to present at ASH, it's still early data, as you said, right? It's 24-week data. So we'll continue to monitor it and we'll continue to study it. So there will be longer term data. So hopefully we can see the durability that we all like to see and the efficacy with the manageable safety profile. And so now what we are doing is, of course, now really working with the regulatory agencies, FDA, MNA, put our submission packages together so we get a regulatory approval hopefully as soon as we can. And so that could be a new combination available for myelofibrosis patients hopefully soon. And we also think there is a potential to study this in other MPN ET. We have some early data. So hopefully there's more to come. What's on our minds, in addition, is of course now that, as you said, combinations have been around in other areas for a long time, but if for MPN, myelofibrosis, it's new. It's going to be new, and will be, it will be probably the first combination that comes out. So we are really thinking about, okay, what do we need to provide in terms of information to physicians, to patients as well, so we can make those right decisions, like when to use the combination for which patient at what time, and also make sure that everybody is aware to make those good choices. So if we have some insights here from you all guys, what you would need for you and your organizations in terms of to be informed, to make those decisions, and the same is then true probably for physicians as well, to kind of, because we need to think about when to give it, to who to give it, and these things. I think that's what's top of mind for us. So when it is approved, that everybody's informed and it can be used in the right way. I hope that's helpful. Yeah, if you have thoughts, we are happy to hear that, even here in the plenum or like one-on-one in the group in the breaks. Yeah.
Thank you very much, Thomas. Yeah.